You wake up feeling okay. You haven't eaten anything yet. You didn't have a cheat meal the night before. And still, your blood sugar monitor shows a high number. Again, you stare at the screen, confused, frustrated, maybe even a little afraid. How can your blood sugar be high first thing in the morning when you've done everything right? You're not alone. This is one of the most common and most misunderstood experiences for people living with type 2 diabetes or insulin resistance. It feels like your body is betraying you. But what if I told you this isn't your fault, and it's actually something your own body is doing to try to protect you? In this video, we're going to reveal the truth about normal blood sugar levels, what they really are, what numbers are safe, and why your readings may be lying to you. You'll also discover what doctors don't always explain about morning blood sugar spikes, even when everything else looks normal during the day. And more importantly, you'll finally understand what's happening inside your body, so you can take back control naturally and confidently. Let me ask you something personal. Have you ever been told that your blood sugar is fine, but deep down, you knew something was off? Maybe you've had symptoms like fatigue, brain fog, belly fat, or intense hunger, even when your lab tests look okay. That's because normal doesn't always mean healthy, and that's a dangerous trap for millions of people. Here's the truth that most people don't know. Many individuals with normal fasting glucose are already in the early stages of insulin resistance. Their pancreas is working overtime to keep their sugar levels in range, but the damage is already beginning. And by the time their numbers finally go up, the problem has been brewing for years. That's why understanding your blood sugar levels is about more than just numbers. It's about patterns, it's about context, and it's about knowing when to trust your monitor and when to ask better questions. Because the number you see in the morning is just a snapshot. It doesn't tell the whole story. Especially if you're waking up with high blood sugar but staying stable the rest of the day. That phenomenon has a name, and we'll get to it soon. But for now, just know that you are not broken. Your body is responding to a deeper signal. Now here's where it gets really important. Many people are walking around with morning blood sugar levels between 105 and 130 mg/dl, thinking it's a little high but okay. But research shows that consistently waking up with levels over 100 can be an early marker of metabolic dysfunction, even if your A1C is normal. And over time, these seemingly mild elevations in fasting glucose can lead to full-blown diabetes, heart disease, and even cognitive decline. So if you're watching this right now, you're doing the right thing. You're being proactive. You're not waiting for the system to catch the problem. You're catching it yourself. That already puts you ahead of 90% of the population. And I want to reward that effort by giving you not just information, but clarity. Because let's be honest, most people are overwhelmed with data. One day you're told to eat more fruit. The next day, avoid all carbs. Some say 90 is too low. Others say 130 is okay. Some websites say your post-meal spike should be under 160. Others say under 140. No wonder you're confused. No wonder your anxiety rises every time you check your glucose monitor. So let me simplify this. There is a way to understand your numbers, and yes, there are clear ranges that indicate stability, danger, or early warning. And once you understand how your body responds to food, sleep, stress, and even time of day, the numbers will finally make sense. Imagine waking up, checking your blood sugar, and feeling calm, not panic. Imagine knowing what your reading means, why it's there, and what to do next. That's what this video will help you achieve. We're going to break down the real definitions of normal fasting blood sugar, normal post-meal spikes, and what's happening behind the scenes when you see a number that doesn't match how you feel. You'll learn about something called the dawn phenomenon, which causes many people to wake up with elevated glucose even if they haven't eaten. You'll learn why insulin resistance can exist even when your numbers are normal. And you'll discover how to interpret your patterns in a way that gives you power, not fear. Because you deserve to understand your own health better than anyone else. and you shouldn't need a degree in endocrinology to do it. So stay with me until the end of this video, because I promise you'll walk away with more than just numbers. You'll walk away with insight, and you'll finally see that those mysterious readings aren't so mysterious after all. In the next section, we'll dive straight into the numbers, what's considered a healthy fasting blood sugar, what your targets should be after eating, and how these ranges differ for people with insulin resistance versus full-blown diabetes. You might be surprised by how narrow the optimal range really is, and how easy it is to miss the early warning signs if you're not looking carefully. So take a deep breath. You're about to understand your body in a way you've never understood it before. Let's begin. Let's talk numbers. You've probably heard that a normal fasting blood sugar level is anything between 70 and 99 mg/dL. That's what most doctors will tell you. But what if I told you that aiming for the high end of that range might already be putting your body at risk? You see, 99 is technically normal, but it's not optimal. The data shows that people with fasting glucose between 95 and 99 are much more likely to develop insulin resistance, metabolic syndrome, and eventually type 2 diabetes. The real sweet spot? Somewhere between 80 and 87 mg/dL. That's where most metabolically healthy people fall, those with great insulin sensitivity and low inflammation. But wait, that's just fasting glucose. What about after you eat? Most guidelines say your blood sugar should stay below 140 mmol/dL 2 hours after a meal. But again, that's a safety ceiling, not a target. The optimal peak? Closer to 110 or 120, especially if you're under 60 years old and trying to reverse insulin resistance. Now here's where it gets tricky, because even if your numbers fall within those ranges, they can still hide a deeper problem. That's where we have to look at how fast your blood sugar rises, how high it spikes, and how quickly it comes down. This is called glycemic variability, and it may be an even better predictor of long-term health than your fasting glucose alone. Let's take 2 examples. Person A wakes up with a fasting glucose of 88. They eat a meal, their sugar rises to 112, and within 2 hours it's back to 90. That's a beautiful curve. Person B wakes up at 92, eats the same meal, and their sugar spikes to 148, staying over 130 for 2 full hours before coming down. On paper, both people are normal, but person A has strong insulin sensitivity, while person B may already be in the early stages of dysfunction. That's why just looking at one number can be misleading. Blood sugar is dynamic, it's a moving target, and unless you're looking at patterns over time, you might be missing the forest for the trees. So if your fasting glucose is around 95 every morning, and you're noticing belly fat that won't go away, cravings after meals, or a dip in energy after lunch, your body might be talking to you, even if your doctor says everything looks fine. And let's not forget about something most people don't even realize. Normal glucose levels can mask insulin resistance for years. Your pancreas is capable of producing large amounts of insulin to keep your sugar in check. But that excess insulin is not benign. It's inflammatory. It promotes fat storage, it accelerates aging, and it silently drives metabolic damage while your sugar stays normal. So what can you do? First, you need to track more than just your fasting number. Pay attention to how your blood sugar responds to different meals. If you have access to a continuous glucose monitor or even a simple finger prick device, start taking readings before and after your main meals, especially breakfast and dinner. Here's a simple protocol. Measure before eating. Measure at 30 minutes, 60 minutes, and 120 minutes post-meal. Look at the peak, ideally under 120, and track how quickly you return to baseline. You'll begin to notice patterns. Maybe oatmeal spikes you more than eggs. Maybe dinner is fine, but breakfast always sends your numbers soaring. That information is gold, because it tells you exactly how your body reacts, not someone else's. And speaking of breakfast, we need to talk about the dawn phenomenon. This is a natural hormonal response that happens in the early morning hours, usually between 4 a.m. and 8 a.m. Your body releases cortisol and other hormones to get you ready for the day, And one side effect of this is a temporary rise in blood sugar, even without food. It's totally normal in small amounts. But for people with insulin resistance or diabetes, that morning surge can be exaggerated, leading to high fasting readings. So if you're doing everything right, low-carb meals, good sleep, no late-night snacking, but your morning glucose is still high, this could be why. But don't worry, we'll show you how to manage it in the next sections. Here's another hidden insight. Stress, poor sleep, and even dehydration can elevate your fasting glucose, even if your meals were perfect. Your liver stores glycogen, and under stress, it dumps that sugar into your bloodstream, just in case you need to run or fight. It's a survival mechanism. But in modern life, we're rarely running. And that sugar just lingers in your blood, confusing your morning reading. Now let's address a question many people ask. Can I be insulin resistant with normal blood sugar? And the answer is, absolutely, yes. In fact, some of the most insulin-resistant people have normal fasting glucose for years because their pancreas is overcompensating. They only get diagnosed when their insulin production starts to decline. That's why tests like fasting insulin, HOMA-IR, or even a glucose tolerance test can catch issues earlier than glucose alone. But even without lab tests, your body gives you clues. If you feel hungry shortly after eating, if you get lightheaded when skipping a meal, if you crave sweets at night, if you have stubborn fat around your belly or upper back, if you wake up tired even after a full night's sleep, these can all be early signs of insulin resistance, even if your glucose looks normal. And the earlier you catch it, the easier it is to reverse. That's the beauty of this information. You don't need to wait for a diagnosis to take action. You can start interpreting your numbers with clarity, seeing the bigger picture, and adjusting your lifestyle accordingly. In the next section, we're going to explore what you can do, practically and naturally, to bring your blood sugar into a stable, healthy range. You'll learn the most effective strategies to lower fasting glucose, reduce post-meal spikes, and improve your insulin sensitivity starting today. So don't go anywhere, because what you do next could change everything. Let's get practical now. You've learned why your blood sugar may be higher in the morning, even when you've done everything right. You've seen how normal readings can hide deeper problems like insulin resistance. Now it's time to talk about solutions, what you can start doing today to regain control and move your numbers in the right direction. We'll begin with your first meal of the day. What you eat for breakfast has a powerful impact on how your blood sugar behaves for the rest of the day. Most people make the mistake of eating something sweet, starchy, or processed in the morning. Cereal, toast, orange juice, even fruit smoothies. And while these options may seem healthy, they often create a glucose spike right out of the gate, which sets you up for a crash, and then more cravings later. Instead, your breakfast should be protein-rich, low in carbs, and high in healthy fats. Think eggs with avocado, Greek yogurt with chia seeds, a protein shake with almond butter. These options help flatten your glucose curve, reduce morning spikes, and keep you feeling satisfied for hours. And here's a powerful tip. Eat a few bites of protein or fat before your carbs. Studies have shown that eating your food in the right order, protein and fiber first, then carbs, can dramatically reduce your post-meal blood sugar response. Just changing the order of what's on your plate can make a big difference. Now let's talk movement. You don't need a hardcore workout to improve your glucose levels. Something as simple as a 10-minute walk after each meal can significantly reduce your post-meal blood sugar spike. When you use your muscles, they pull glucose out of the blood without needing insulin. It's one of the easiest and most effective strategies you can use, especially after dinner. Even better, stack these habits together. Have a balanced, protein-rich meal, and then go for a short walk. Over time, your fasting glucose will drop, your energy will stabilize, and your insulin sensitivity will improve. Let's not forget about sleep. Poor sleep, whether it's short duration, disrupted quality, or inconsistent timing, increases cortisol, reduces insulin sensitivity, and raises fasting glucose. Aim for 7 to 9 hours of restful sleep per night. Keep your room dark, cool, and quiet. Go to bed and wake up at the same time every day. Sleep isn't just rest, it's blood sugar therapy. And what about stress? Chronic stress keeps your body in fight or flight mode, releasing cortisol and pushing glucose into your bloodstream. If you're constantly anxious, overworked, or emotionally drained, your sugar levels will reflect it, no matter how perfect your meals are. That's why even a few minutes of deep breathing, meditation, or journaling can help lower your numbers. It's not just about relaxation, it's about reversing the biological stress response that drives your glucose up. Now let's talk about something most people forget: hydration. When you're even slightly dehydrated, your blood becomes more concentrated, and your glucose readings can rise. Make sure you're drinking enough water throughout the day, especially first thing in the morning and before meals. You may also want to explore apple cider vinegar. Taking a tablespoon diluted in water before meals has been shown in studies to reduce the post-meal glucose response. It's not a magic bullet, but it can be a helpful addition to a balanced lifestyle. And of course, fiber is your friend. Eating more non-starchy vegetables, chia seeds, flaxseed, and even psyllium husk can slow down digestion, reduce glucose absorption, and promote healthy gut bacteria, which also affect insulin sensitivity. One powerful technique that's often overlooked is early time-restricted eating. This means you finish your last meal earlier in the evening, ideally before 7 p.m., and give your body a longer fasting window overnight. This strategy has been shown to improve fasting glucose, insulin levels, and inflammation. It works with your circadian rhythm, and it helps prevent those stubborn morning spikes. Now let's talk supplements, but only briefly. There are a few compounds with strong evidence for supporting blood sugar regulation: berberine, magnesium, alpha-lipoic acid, and chromium. These can help some people, but they're not a replacement for lifestyle. Use them as tools, not crutches. And what about weight loss? Losing even 5 to 10% of your body weight can have a huge impact on insulin resistance and fasting glucose. But the key is losing fat without losing muscle. Focus on high-protein meals, resistance training, and enough calories to fuel your body without excess. Here's another overlooked factor: meal timing. Eating large meals late at night, especially ones high in carbs, can raise your fasting glucose significantly. Try shifting more of your calories earlier in the day and keeping dinner lighter and lower in carbs. Let's summarize the key strategies so far. Eat a high-protein breakfast, low in carbs. Go for a short walk after meals. Prioritize sleep and manage stress. Stay hydrated and eat more fiber. Use meal timing to your advantage. Finish your last meal earlier in the evening. Use targeted supplements if needed. Avoid hidden sugars and processed carbs. All of these strategies work together to improve your insulin sensitivity, flatten your glucose curve, and bring your fasting sugar down into a healthy, stable range. But here's what matters most: consistency. You don't need to be perfect. You just need to be consistent. A single day of clean eating won't fix your glucose, but a week will begin to show results. A month will show patterns, and 3 months can transform your entire metabolic profile. You have more control than you've been told, and your body is more responsive than you may believe. In the final section of this video, we'll pull everything together. You'll understand how to combine this knowledge into a clear, simple plan. We'll also talk about the emotional side of this journey: the fear, the frustration, the guilt. Because you're not just a number on a screen. You're a person trying to do the right thing in a confusing world. So stay with me, because what comes next could be the turning point. Let's pause for a second and reflect. If you've watched this far, it means something inside you is ready for change. You're not just looking for numbers, you're looking for answers. And more than that, you're looking for peace. Because dealing with blood sugar problems isn't just about food, numbers, or charts. It's about the emotional roller coaster that comes with feeling like your body is out of your control. The fear when you see a number that's too high. The guilt when you eat something and regret it. The frustration of doing everything right and still waking up to a spike. Maybe you've blamed yourself. Maybe you felt weak, undisciplined, or hopeless. But I want you to hear this clearly. It's not your fault. You're living in a world designed to keep your blood sugar high. From ultra-processed foods to chronic stress, poor sleep, sedentary routines, artificial lights at night, and misinformation everywhere. The odds have been stacked against you. But you're here. You're learning. You're fighting back. And that makes you powerful. Let's recap what you've learned so far. You now understand that normal blood sugar levels aren't just about hitting a specific number. They're about how your body handles glucose throughout the day. You know that. A fasting glucose between 80 and 87 is a strong sign of metabolic health. Post-meal spikes should ideally stay under 120 and come down within 2 hours. The way your sugar rises and falls, your glycemic variability, matters just as much as the numbers themselves. Even if your readings are technically normal, you can still be in the early stages of insulin resistance. Morning spikes may be caused by the dawn phenomenon, stress, or liver glucose dumps, not necessarily by something you ate. Lifestyle changes like better sleep, smart eating patterns, walking after meals, and managing stress can dramatically improve your numbers. But most importantly, you've learned that your blood sugar is not a mystery. It's not random. It's a signal. And once you understand the language of your body, you can finally respond with confidence instead of fear. Now imagine what happens when you apply this knowledge consistently. You start the day with stable energy. You eat without fear. You sleep deeper. Your cravings fade. Your mood lifts. Your body begins to feel like it's working with you, not against you. And when you check your numbers, you're no longer guessing. You're no longer panicking. You know what they mean and what to do about them. That sense of control, that peace of mind, is what this journey is really about. You see, blood sugar management isn't just for people with diabetes. It's for anyone who wants to live longer, think clearer, feel younger, and prevent disease. Glucose is the foundation of energy, inflammation, hormones, fat storage, and even brain function. When it's out of balance, everything else suffers. But when it's stable, your whole life changes. You may have been told that blood sugar issues are irreversible, that they only get worse, that you'll be on medication forever. But countless people have proven that's not true. With the right knowledge and consistent action, you can lower your numbers naturally, improve insulin sensitivity, and regain the health you thought you'd lost. And the best part? You don't need perfection. You don't need to count every carb or cut out everything you enjoy. You just need to understand your body and make choices that support it. This is not about fear. This is about freedom. Freedom from the highs and lows. Freedom from confusion. Freedom from shame. Freedom to live your life with clarity, confidence, and energy. But I want to leave you with something deeper. Behind every number is a story of stress, of survival, of someone who's been trying, maybe for years, to feel better. That someone is you. And I want you to know that you're not alone. There are thousands of people out there, just like you, who are taking control of their blood sugar, naturally, one decision at a time. People who've said, enough is enough, and decided to take their health into their own hands. They didn't wait for permission. They didn't wait for a crisis. They started with one video, one insight, one new habit, and today they're thriving. You can be one of them. The journey starts with understanding, then it becomes action, and finally, transformation. If you've made it to this point, it means you care deeply about your health. You're not here by accident. You're part of a growing movement. People who are tired of being in the dark, tired of being confused, and ready to take ownership of their bodies. And the truth is, you already have everything it takes. You just needed the right guidance. Now you have it. You understand what normal blood sugar really means. You know why your numbers behave the way they do, and more importantly, what to do about them. You've learned how to lower your glucose naturally, how to calm morning spikes, how to eat, move, sleep, and live in a way that supports your body instead of fighting it. But the most powerful thing you've gained is clarity. That alone can change your life. And if you're wondering how thousands of others have already started lowering their blood sugar naturally, the answer is waiting for you in the link in the description. What they've discovered might just be the missing piece you've been searching for. You deserve to feel good again. You deserve energy, freedom, and peace of mind. Don't wait for things to get worse. Take the next step now. Your future self will thank you for it. And if this video helped you, please don't keep it to yourself. Click the like button, leave a comment to share your thoughts or questions, and most importantly, subscribe to the channel. We're building a community of people just like you, people who are ready to feel better and live stronger, one step at a time. Your journey doesn't end here, it starts now, and I'll be here to guide you every step of the way.